Hello, everyone, and welcome to this edition of Ask the Experts. And we're going to be talking about anxiety in the classroom. So, as most of you watching know, it is back to school time. Whether you're in high school, middle school, elementary school, college, graduate school, people are heading back to class. And what we know is there's a lot of anxiety, there's a lot of OCD that pops up around the school time. It could be for the person with OCD themselves, who might be a student, but it also could be for the parents, for the family. There's a lot of anxiety in the household. And so, I'm so excited to have three experts with me that are going to help navigate some of your questions around anxiety in the classroom. So just a little bit of introduction of these live streams. We're here every Wednesday at 12 noon Eastern. We have Ask the Experts, where we bring on special guests who ask questions and answer and talk about specific topics. We also have Ask the Experts, where Liz McIngvale, myself, and sometimes guests answer your questions. And we also have a research roundtable every second Wednesday of the month, where Dr. Abramowitz and Kyle King go through the latest OCD research and kind of make it digestible for you at home. So make sure to join us every Wednesday here at 12 noon Eastern for a live stream. You are watching on behalf of the International OCD Foundation, your biggest go-to for anything OCD and related disorders. So make sure to go to IOCDF.org after this live stream and get any information you may need. And remember, these are being recorded. So if you missed some of this or you want to share this with a friend or watch it back, you can definitely go to our YouTube channel. That's youtube.com/IOCDF. My name's Chris Trondsen. I'm a board member at the IOCDF and a lead advocate who has OCD, and I'm a clinician here in Orange County, and I am one of your co-hosts. And usually I have Liz McIngvale on my side, but she is human, and I think she's traveling and having fun with her kids. So I'm super beyond excited to have my special co-host, Denise, who is a board member with myself, but beyond just being a board member, she has been really one of the leading forces on helping to create the conferences, create the research, create the anxiety in the classrooms, create clinical work, really kind of spearheads doing treatment in the home. So I'm beyond honored to have Denise Egan-Stack, who is a board member. And did I miss anything? Introduce yourself, Denise.
Nope, all OCD all the time. You got it all.
All right. Well, before I jump in and introduce our guests, just remember that this live stream is for educational purposes, for resources to get your questions asked, but we can't be a crisis hotline. So if you're really struggling at home, make sure to dial 911, or you can now dial 988, and that way you can get the help that you need. You can always go to your nearest emergency room or reach out to your psychiatrist, etc. if you're really struggling. This is not, we can't do crisis work here. And remember, please be respectful. This is being live streamed on all different platforms, including Twitter or X, including our YouTube channel. We also are on Twitch. We're on LinkedIn. So, we're being recorded so you can watch us back and be respectful. So I'm super excited to have our two guests today that are going to help us navigate anxiety in the classroom. So I'm going to start with you, Ez. Why don't you introduce yourself?
Sure. Thank you so much. So my name is Ez Homonoff. I'm currently working as a school psychologist in the Connecticut public schools. And aside from that, I also grew up with OCD and received treatment starting at 12 years old. And I'm really excited to be here. The advocacy community has always been very important to me. And I've been an IOCDF advocate since 2019, officially.
Oh, we're happy to have you. And Marni, our good friend from Florida, how you doing?
I'm well. How you guys doing? Good to be here. I'm Dr. Marni Jacob. I'm a clinical psychologist at the Jacob Center for Evidence-Based Treatment in Boca Raton, Florida. I see children, adolescents, and adults, specialize in OCD, anxiety, and OC-related disorders, and also involved with OCD Central and South Florida, which is the official affiliate of the IOCDF in Florida. And yeah, great to see everybody. Pleasure to be here.
Yes, we're excited to have you. Well, just to jump in, I mean, obviously one of the projects that the IOCDF has put a lot of energy behind is anxiety in the classrooms. And we know that this time can be really stressful, not only on the person with OCD, but the entire family. So maybe we'll start with you, as talk a little bit as a school psychologist. What are some of the things that you're seeing in your office? What are the things that you experienced because you have OCD yourself around this time? And just in general, what are some of the things that families should be looking out for?
Yeah, I think one of the things that people may or may not know is that OCD is often triggered by transition periods and times of that kind of transition from experience to experience, from place to place. And the school vacation to school transition can be especially triggering for students with OCD. So sometimes that means even students who have been through treatment, they may see a resurge in some of their symptoms. That might mean more visible or more just continued compulsions. So things kind of tend to increase a little bit, either right before the school starting or as the school year just begins to start. And sometimes that's also triggered by the uncertainty. So in general, right before school starts, there tends to be an uptick in OCD symptoms because things are just uncertain. They don't know what the school year is going to look like. They don't know what their teacher is going to be like. And especially, I think, the key sort of transitions from elementary to middle school and from middle school to high school, and then from high school to college, those can be especially triggering because there's even more unknowns and uncertainties there. And in particular, I think as the school year starts, that sort of uptick in symptoms can then almost create more symptoms, because I think in students and even in myself included, when you notice those sort of symptoms coming back or things getting worse, it then is more anxiety provoking, which makes the symptoms come back even more and makes things kind of feel a little bit worse. And so it's this vicious cycle that sometimes is hard for students themselves to identify, that, oh, I'm making myself anxious, so I'm making my OCD even more just potent in my life. And so being able for identifying that this could be a challenge and that this can be a anxiety about anxiety moment is really important.
Right. So we really, I think, Ez and I presented on some of this at the conference, and I think really we want to educate parents so that they can normalize, like, this happens. I mean, like, everybody gets a little anxious before school starts, anxiety, OCD or not, and like, let's expect it. And when it happens, let's not panic, and like, let's have a plan around it. So just to normalize it and predict it is also a helpful intervention.
Yeah, and Denise, I want to throw up the first comment to you and get your feedback, and then Marni, I want to bring you in as well. But Rachel at 1204 from Hooligan Mama, fantastic topic. My 18-year-old son with OCD is starting college in 2 weeks. It's the first time back in the classroom in 2 years. Can you talk a little bit about that comment? Because I think one of the common things is sometimes people have to take some time off of school. They might need to be homeschooled. They might need to do stuff from home just because of the OCD. Any advice to people maybe going back to school, either returning back, obviously, but people that maybe have been out of the classroom for a couple of years? Like, what are some preemptive things they can do to prep for that?
Yeah, I guess the first thing is to know, like, I'm glad that you took a little bit of time off, and you hopefully, you've got the treatment that you needed and you learned the skills that you need and you're going back. And so congratulations. I think that that's absolutely wonderful. I think going from high school to college is hard because you're losing the support system from your family. Like, your family, it's a support system. It's the structure. It's reminding of the meds. It's like, doing your laundry or helping with laundry or creating meals or, just having your favorite foods in the house or something reminding you about appointments, and that is gone. And so I think that that's a big transition for kids, especially who have struggled. And so I would say, like, making sure when you're going that you have a plan in place for what is your support system? How do you access it? What is the way in which you are going to be creating structure and then maintaining structure? How do you know when you're really struggling and you need more assistance and more help? Like, what is your treatment team, and how, like, do you have your appointments set up? Do they actually now still fit with what your class schedule is? What are the mental health resources that are on campus, and how do you access them? Do you need accommodations? If so, what is the accommodation process, and have you engaged in that all ahead of time? So those are the kinds of things that I would be talking about with parents, kids and parents who are going back to going to college, number one, and especially going back to college or going to college after having taken some time off.
And Marni, thank you, Denise. And can you expand on that? Because I think one of the things people hear mixed messaging about, so maybe you could help clear it up. Obviously, people, like Denise said, are going to need those locations, especially if they haven't been in school for 2 years. It's great to have them. And often people hear in OCD treatment, we shouldn't be accommodating the OCD. So how do you find that balance of knowing if you should get accommodations, if you shouldn't? Should they be permanent? Should they be temporary? Can you help kind of have us navigate through those?
Yeah, so that's definitely one of the most common questions that come up, and people are really unsure what to do. So, when we talk about accommodations, accommodations in general are there to help make sure that people have equitable access to learning, to resources, and that they can meet their potential, right? So sometimes we use accommodations if somebody's anxiety disorder, OCD, or disability is impairing or interfering with their ability to get that equitable access. And so with OCD, it functions a little bit differently in anxiety than some of the other reasons that will seek out accommodations. So with OCD, if we take just a common example of somebody who is excessively checking their work, right? So maybe they're doing an assignment or they're taking a multiple choice quiz and they're finding that they have to go back and feel the urge to check and recheck multiple times. It's going to take them a lot more time to progress through that test. And so sometimes there's or at some point in treatment, we'll work with them and we might have accommodations of extra time so that they can work through it. And it doesn't feel like, well, I only have 30 minutes and my rituals are making me take 90 minutes. So I end up failing all the tests. So we'll incorporate accommodations, but the difference with OCD, which might be different than dyslexia or something else, is that we're hoping that people get better capability of managing their rituals and reducing them over time. And so I would say in an ideal world, if there are accommodations for OCD, the hope is that somebody is working on those targets in treatment to decrease those rituals. And then maybe they develop mastery over taking tests and they're not checking 3-4 times. Maybe they're only checking once, which is more reasonable. And then the hope is that we could reduce or remove the accommodations over time. So I guess my overarching answer would be that this is all individualized based on the person, their specific circumstances, and their specific rituals and compulsions, because it's not a one size all fits accommodation for everybody. You have to really think about, okay, how's this going to help the person? And, we don't want over time, we don't want it to maintain the problem. So we have to think about how we can, modify it over the course of their school.
Right. And I think so, Marni, you just did a really nice job talking about accommodations in school. These are rights. These are rights that kids have within the public school system. So it's through a 504 plan or IEP. And as you might want to talk a little bit more about that as a school psychologist, but as a parent on this live stream, here's where I think sometimes parents get the mixed message. So if you are at the conference or you've done anything online, we say, we want to reduce family accommodations. So families get caught up in OCD and we want to reduce family accommodations because it is counter-therapeutic. But then you come to a talk on anxiety or OCD in the classroom and we're like, your child deserves accommodations. It's a right within the school system. So just know that it's a word that we use with family accommodations. We want to reduce it. And when school, we really want to access your students' access to accommodations. So in some ways it's a mixed message, but today we're talking about accommodations as a good thing, as a right of your child within the school system. And they typically are realized through a 504 plan and an IEP. And so as you want to talk about that just a tiny bit?
Yeah, definitely. I think that, first of all, I really appreciate Marni's explanation of the accommodation versus family accommodation. So academic accommodations are definitely primarily there to help the student function in school. And that's something I have to remind teachers as well, as they feel like, what do I do if my student has OCD? And I say, at this point, you're really just helping them function in school. You don't have to be their therapist. So that's something that I've had conversations with teachers in the past about. But for IEPs and 504 plans, so technically a student, if they have a medical diagnosis of OCD, they are eligible for a 504 plan, which is part of the Section 504 of the Rehabilitation Act. And so it's basically a law, a federal law that says that students are entitled to accommodations that provide them equal access with their peers. So in that kind of equitable access means that if they're struggling in a certain area of school in particular, they can and should receive accommodations to help promote that equity in their academic performance so that they can achieve at the same rate as their peers. And 504 plans can also sometimes include counseling, depending on the state, depending on the school. They might have a specific way of writing that in, but getting counseling at school, typically that would not be ERP type counseling. That wouldn't be explicitly for OCD, but it would just be something to supplement whatever they're getting outside of school. But the academic accommodations piece, students can receive certain accommodations like extended time on assessments. There's typically accommodations where they can, if they're having trouble with rereading or rewriting, maybe they can have audiobooks. There's different kind of ways that the school can help, not necessarily accommodate the OCD, but accommodate the students' distress from the OCD so that they can achieve adequately in school to the best of their ability while they're working with, ideally with a therapist, to eventually reduce those accommodations if possible. And that's really important. And then there's sometimes students who the 504 plan is not enough, and an IEP or an individualized education plan would be more warranted. And that is a little bit more of a rigorous process typically, and it is usually state dependent. So there are usually, while federal law is really what governs 504 plans in the United States, state law is typically what governs the individualized education plans. So it really is dependent on what your state laws are, on what the process looks like for that. In Connecticut, for example, it's going to look different than in Pennsylvania, which is where I went to school for school psychology. So I had to relearn the whole process when I began working in Connecticut. And the other thing about IEPs is, unlike the 504 plan where they are having their medical diagnosis of OCD as the reason for the 504 plan, an IEP, it's interesting, they can't qualify a student based on a specific diagnosis. It has to be under what's called an educational classification. And typically students will meet the criteria for either what's called other health impairment or emotional disability. Sometimes that's called emotional disturbance, but typically they call it emotional disability. And there is kind of typically state by state lingo or words that are used to describe what would qualify someone under OHI or other health impairment, or ED or emotional disability. And that is also something that's really up to the school. They really need to, if this is something you're considering, the school should be working with you to come up with what the best label would be. And they would typically have to do testing to make that determination. So some sort of psychoeducational testing is done to provide the IEP. And the main difference from an IEP and a 504 plan is that an IEP is typically only granted when there's an educational impact. So meaning that it's going above and beyond just accommodations. There really needs to be an additional piece of instruction, an additional piece of support where their grades typically are really suffering, or their ability to get to those grades, even if they're straight A's, is to the point that it's dysfunctional for them day to day.
Marni, I thank you, first of all, and I just learned a lot. So it was like the live streams where I learned a lot. Marni, what are some things that parents should be looking out for, or people that are watching this with OCD? Like, what are some of the compulsions? What are some of the difficulties that people have that you often see associated with struggling in school that maybe people should be starting to think about, either accommodations or even maybe stepping up some sessions with their therapist as school starts?
Yeah, so I think first and foremost, OCD can impact anything, right? So I think when we talk about the impact on academics, a lot of it is focused on how they learn, how they complete assignments, how they test, how they study. And so a lot of times rituals can impact some of the behaviors that they're doing. It can also be obsessions that are impacting it too. So let's say I'm sitting here studying for my chemistry exam, and all of a sudden I'm having intrusive thoughts, and that's getting me off track. So it can interfere in that way. It can interfere with compulsions. So I think, as mentioned, some of the common reading, rewriting, erasing, seeking reassurance is really common. Asking questions related to academics over and over again, excessive research, perfectionism, feeling that you have to do every assignment perfectly. We see just right symptoms, where you can't stop something until you get some sort of internal feeling of it being right or okay or balanced. So a lot of times those are things that we'll see academically, but we can also see academic impairment in the sense of my child is late to school because they're ritualizing in the morning. And so they may come into the classroom late, get a tardy, and everybody's making the assumption that this child isn't taking school seriously, but they're really struggling in the morning with excessive washing, cleaning, hygiene. You need to check and recheck their backpack. So I guess anytime you see significant distress or impairment, we want to take a better look at what might be driving that. Are there things that are underlying that? And by asking some of those questions about what's getting in the way, why does it take longer? Why does it seem harder? That can help us determine whether OCD or anxiety could be at play. And, then we would obviously refer that person to treatment or support resources to get a better handle on whatever is causing that impairment. I think in general, OCD can often be very misunderstood. And it's really important that whomever is involved, whether it be parents, therapists, if it's a college student themselves, that you often have to take a pretty active role in advocating and sometimes explaining, educating what's driving the problems that are appearing, and obviously problem solving to come up with solutions, because it may not always be apparent.
It's funny, when you were talking, it totally flashed back to a moment in school. And one of the biggest compulsions I used to do in school is constantly ask how I was doing. And I remember I was in like a kind of like I'm an advanced middle school, like that, like an advanced program. And I had to take like a little test to see if I was going to go to the advanced, or that was elementary, to go to advanced middle school. And like I was answering the questions. I knew deep down I was killing it, but I kept asking, like, am I doing good? How am I doing, et cetera. So I'm glad you bring that up, because I think sometimes people recognize like the rereading or the checking, but it can be asking a lot of questions. Denise, what I want to ask you, because you did a talk for our family group, and I think you handled this really well. One of the things I hear all the time around this time is like this big fight in the mornings. A mom has the kid with OCD, but also has two other siblings. She has to be to work. There's like a 2-minute wiggle room, and the person is just compulsing, can't get out of the room. The parent doesn't know what to do. What are some things, I know there's never going to be a perfect solution, but what are some things families can do in the beginning of the day, or what kind of plans can they have so these kind of things don't happen, especially getting out, school refusal, or being late and kind of messing up the whole school schedule for the family?
Right. So I will just note that school refusal rates have skyrocketed since COVID. When during COVID, everyone was just doing the best they can, and it was remote learning, and anxious and depressed kids, that was actually like the avoidance or not having to do that was actually like they like that, but it was just so much harder to get them back in. And I think people have kind of adopted an attitude that school is somewhat optional. And so I think that what happened in COVID, and just how difficult it is for people to sit in discomfort with anxiety or OCD to like get themselves back to the classroom is just so hard. So if you're experiencing that as a family, like, that's okay. There are resources for you, and there are specific things. There's like best practices for how to handle this. And if you want to learn more than what I'll say in the next minute or two, we do have the link to a school refusal organization that you can learn a little bit more about it. But I think the key thing is to understand that a lot of this planning has to happen outside of the triggered moment. It is really hard when people's brains are on fire, when someone's OCD is triggered, when a parent's sense of urgency and crisis is triggered because they're trying to get this kid out the door and they have 2 more and we're going to be late. I'm going to be late for work and the dog hasn't even gone out yet. It's really hard to think. It's really hard to process information. It's really hard to connect in a meaningful way to like move through those moments. And so I think it's important to have those conversations and planning sessions like outside of the triggered moment. So if your child is not starting school, like my youngest starts on the 26th. So we have a few days, right? So we can be talking about like, what do we anticipate is going to be difficult? What are the ways in which I can help you? What is not helpful? Okay, so what are the expectations? What can we do the night before that will help you get out the door the morning of? And of course, if your kid's in treatment, we would be pulling in, the clinician to help us with all of this planning too. But again, Ez started off this whole talk with like, this is a transition. Transitions are really hard for people, especially people with anxiety and OCD. Let's predict it. Let's plan ahead of time. Like, let's not panic. Let's, be thoughtful and planful. Let's utilize information we knew from past years. Let's utilize skills that we actually have. And then, if your child is really struggling, like, more is not always better in the moment. Like, pushing harder is not always going to get you what you want. There's going to be more affect, and that can slow people down. And so it might be that you just need to leave your kid for a little bit. Like, I love you. I think my presence here is making things a little bit worse. I'm going to go help your sisters. And then I'm going to come back and check in on you. What's one thing you want to work on between now and when I come back? Like, so just like step by step, break it down into smaller, more manageable pieces. Remember that you're not mad at your kid. You're mad at the OCD. Get on the same side as your kid. So that's how I would sort of work it out of the moment. And that's how I would work it in the moment. But there's nothing like super crisis-like about one late morning, right? So don't attach too much meaning to the actual struggle. Just kind of be collecting information. Be like, okay, tonight after school, we need to have a talk because like we can't do another morning like that. We'll have dinner, I'll help with homework, and then we're just going to chill and talk about how we can do differently tomorrow, because your child wants to do well. Your child's in pain. Your child is struggling. And just remember that there's always a basis of like struggle there. And then you're more likely to align with your kid and plan going forward versus like, why is it so hard? Like, he's going to make me late again. Like, you want to make sure that you're just understanding, like, your kid really wants to do well and does not want to be in this situation either.
Denise, where were you when I was in high school? Because my mom thought what she was supposed to do is turn on my lights and scream at me, and that was going to somehow wake me up. And she didn't realize that just triggered my anxiety, which made me have a harder time. So, right. Denise, you needed to be around during my high school years. Thank you.
So this is why, as Marni and I are doing this now, right? Because we want to try to get families earlier in the process, not later. But also, like, I think parents, and again, I got 3 kids. They all have anxiety and OCD. Like, it just turned out that way. I was specializing in this before I had them. And I was like, oh, I got 3 kids with OCD. So, okay, I've got to practice what I preach here. You really need to make sure your own anxiety is kind of managed, right? Because anxiety runs in families. We all want to do well. We want to be a good parent. We want our kid to get to school on time. But like, is that really what we want? Or do we want to maintain connection in that moment to help them feel like that you guys are in it together and try to problem solve ways to move forward? So I had to make sure I was really practicing what I was preaching about my own affect in these moments in order to be skillful.
Yeah, I really agree so much with what Denise said. I think the more you can preemptively like kind of anticipate and plan for the challenges that are going to come up, that's going to really help it go smoothly for everybody. So, if you've been, if you have a kid who's been struggling with anxiety or OCD for a while, you probably know some of the things that trigger them. So if you think, oh, my child has a hard time picking out their clothing in the morning because they feel that it has to be just right and it has to feel okay, then maybe that's something that they do the night before. If there's somebody who checks and rechecks their backpack, maybe you do that the night before. And then have a plan for the morning. So, okay, I'm going to wake you up at this time. Do you want me to sit and kind of hang out with you, or do you want me to disappear? So I try to really put the kid, where possible, in a little bit of the driver's seat so that they can, say what they want to do and what they think is going to be easiest to help with that smooth adjustment in the morning. I would also build in some sort of a reward. So again, normalizing. It's hard to go from sleeping later to have to wake up a little bit earlier and get back to school. So, let's have a reward in place so that this can be an incentive to get them excited. How else can they be excited? Maybe they have a new Elsa lunchbox that they're really pumped to bring to school. So I think we do talk about a lot of the anxiety about school and the transition, but I think we don't often do enough of talking about the amazing aspects of school too, where, you're getting to sit and learn, and not everybody thinks that that's horrible. So I think if we can really just make sure that we have a balanced discussion about, well, maybe you're anxious about this piece of the day, but what about this other part of the day? That can be really helpful. And, just to echo, yelling, screaming, it's not effective. It doesn't work. It's just going to increase the intensity of the situation for everybody. And I think as parents, sometimes if we know that our child's going through a stage of transition, if we're worried a little bit that it's going to be, they might have a delay getting out the door, I think where possible, if we're able to, try to understand that in planning our own schedule. Maybe we talk to a boss and just let them know that we're getting our kid back to school. I think most people are human and that they can understand that. And also to echo, it's okay for kids to have natural consequences. If they're late because they're not getting out the door and they have a tardy, some kids that can be aversive enough that it helps motivate them to then be on time the next day. So we don't need to coddle them all the time. And right, if they're late and they have to deal with that, that's okay, because that's life. And then we can certainly problem solve after if we need to.
I think that's such a good point. Also about that natural consequences. I'm a firm believer in that, because I think especially a lot of students who end up facing those natural consequences, they do feel motivated. And I think that's why I'm also a firm believer in, if you're going to send the student to school, or if you're deciding, do I send the student to school late or do I just keep them home, send them to school late. That's always when in doubt, because I think that is a lot more motivating to have that experience of being late to school than to just get to stay home the full day.
Right.
And also, I think it is hard, just to acknowledge it's hard sometimes to keep our emotions in check when we're faced with seeing someone in such distress. But the more we're able to keep ourselves calm, and the more we're able to be that beacon of calmness for our kids, that is much easier for them to then reflect that calmness. So the more distressed we appear, the more distressed they appear. The more calm we can be in the moment, ideally, the more calm they are able to be later on, or even in that moment, they might just be able to see that.
Yeah, I think that's important. I like to, just to kind of echo that importance. If you know your child is struggling with a certain ritual in the morning, that's something you can talk to them ahead of time about. Hey, if I notice that you're tying and retying your shoes multiple times, how can I support you in that moment? Do you want me to just leave you be and not say anything? Do you want me to give you kind of a quick reminder? Because if you can do that ahead of time and have a plan for it, it's going to go a lot more smoothly than if you're just guessing as a parent. And if you're just guessing as a parent with a child with OCD and anxiety, there's a good chance that no matter what you do, it's not going to be right. So I like to have that discussion ahead of time and involve your child in planning.
Right. Can I just pick up totally every single thing that was said is like right on. And this is one of those talks that you could like replay a couple of times if you really were really struggling in this, because there's just so much good information here. I just want to pick up on one thing that, as Marni said, it is important that your kid get to school, even if they're going to be late, not just because of natural consequences, which is an important point. But if your child, OCD is all about avoiding discomfort, right? And so you might get them ready for school, and then they might be like, well, I don't want to go now because it's going to be late and I'm going to be embarrassed to walk into my class. And if you are just so tired out and like you have no more capacity left, you're like, fine, stay home. There is a reinforcement there that is very catchy, where it's like, I will stay home to not feel uncomfortable. That's where we start to see these school avoidance come into play, right? It's one of the ways in which we see school avoidance come into play. And once your kid starts to stay home, it's really hard to get them back. And when they're little, they're smaller, it's easier to get them to school. And when they're bigger and sometimes taller than you, it's harder to get them back to school. And what ends up happening with these school refusal or school avoidance is that the older they get, the more the kids just kind of disappear. Right. And so it's super, super duper important. Like school avoidance will come in a lot of different directions, but this is one of them. Please send them back or send them in late, because it's something that's a really hard problem to walk back from.
The other thing, and you kind of touched on this, Marni, the other thing, and to add what you were just saying, Denise, I think, I work with a lot of teens, a lot of, preteens, a lot of young adults. And what I notice different with the population than maybe when I work with my clients that are in their 30s, 40s, 50s, et cetera, is I think people that are a little bit more in that adult stage, like do things because they know they should. Whereas my younger clients are like, what's in it for me? And so there's always a focus in my sessions about, let's get you signed up for a club at school. Let's get you on a sports team. Let's get you on like drumline, something. And do you recognize that going to school is where you get to see your friends, you get to connect with them, they're making plans for the weekend. So if you're not at school, you're missing cheer or you're missing debate, right? Which is something you love doing. And all your friends are planning to go to Magic Mountain this weekend, or somebody's throwing a birthday party and you're not getting the invite, or you're not getting, you're going to have to take your own car or Uber because they've already packed the car because they've already planned it. So trying to see like, hey, this is why school is good. And I always kind of own it too. I'm like, look, you're right. You will probably not use 86%. Nobody's ever ran up to me on the street and been like, what is the, the square root of a triangle? And what's Pythagorean theorem, Pitt theorem? I don't even remember the name of it, or the, the energy of the cell, right? Like, no, it's not going to be that, but you're going to make connections. You're going to learn how to connect with people. You're going to be playing on a sports team. Oh, you're doing yearbook this year. Don't you want to have your work on that? So I think that's something I try to do with clients. It's like, what's in it for you?
Right.
I love that. I also, I hope that's okay. I wanted to add that sometimes when students all the time will say, well, I'm never going to use the equation I'm learning today, or I'm never going to need to know how to solve a chemical equation. And I say, you may not ever need that, but you do need to know how to learn. It's important to learn how to learn. And even if you're learning something that's hard for you now, you're never going to stop learning things that are hard for you. So learning how to learn is so important. And then usually they're like, okay, fine. So that tends to work.
Right.
And I'm like, what if you go on Jeopardy? Don't you want to know this? That's going to be a question. Don't Jeopardy.
Right. But I think one of your points, Chris, was that school can't just be a total drag. You want to find opportunities for the kids to feel a sense of community at school, and that will increase the motivation to want to go, so they don't miss cheer, so they don't miss the field trip or whatever. But it's also through these connections that your child is developing relationships with their teachers or their coaches or the lady at the front desk or something, and they become the support system that helps your child, like receiving them when they're coming in late, helping like to buffer them going into the classroom late, like seeing them in the hallway. Hey, so great to see you. Like that becomes a support system that a parent will rely on within the school system to actually get their kid to come in late and feel comfortable, with the transition from home to school, especially if they're late.
Yeah, I mean, so much of my pushing through OCD before I even had the diagnosis was because of sports. There were so many times I did not care about my schoolwork because my brain, I had perfectionism. It was so hard to do the schoolwork, but you had to maintain a certain GPA to be able to play sports. And I played tennis, I played volleyball, I played soccer, and I played football. And so for me, it was so important to be on that field. And so that kind of motivated me. So people have to have motivation. As I want to toss this comment to you, and maybe you could answer it more from like a personal lens. At 12:10, Hooligan Mama adds that her son's in treatment, taking medication, was online school as a junior and senior. He's excited, and yet I've seen some old OCD habits returning. Now I understand it's due to the transition time. Thanks. As a person with OCD, like what are some things that you can do if you know that every time you're switching a new grade, a new school, it's going back? What can the person with OCD themselves do to kind of get prepped for that maybe uptick in symptoms?
I love that question because like what Marni was saying earlier, like it's so important to involve the person themselves in the treatment and having that sense of agency and what can I do myself instead of just having to only rely on others. That's so important. And I think in terms of the transition time, the phrase I use is like cope ahead, like in DBT, dialectical behavioral therapy, that idea of coping ahead for things that could go wrong or things that might go south, and not necessarily in a panicking way, like a what if this, but more just like calmly coping for potential and likely roadblocks. So what I typically would say is, first of all, just expect that it could happen. Not in a dreading way, but just in a like, hey, I'm probably going to feel a little bit of anxiety uptick and maybe a lot of bit of anxiety uptick in X month. And knowing that you're prepared for that can sometimes help alleviate some of those higher upticks and can help alleviate some of that anxiety about the anxiety. I would say, so starting off by just being mindful of the anxiety without dreading as best you can. Also, as best you can, doing things ahead of time. So something I recommend is like buying planners, buying like school supplies before the beginning of that school year. Getting as organized as possible before the start of the school year, because as much as we want to sometimes put that off, not only does it help to do it right away and avoid the avoiding, but it also then when you're in that more emotional stressed out state, it is harder to get things done. So doing as much as you can when you're not in that overwhelmed state, including for college students, signing up the earlier the better for accommodations through the Disability Support Services Office. If you're kind of saying, oh, I may need them, I may not, go for it anyway. That is always my recommendation. I used to work at the Disability Support Services Office at Lehigh University as part of my graduate assistantship. And while I was there, we often would see students who second semester or even end of first semester saying, oh, I really didn't think I'd need this, but I need this now. And their grades were slipping, they were stressed. And this could have been prevented if they had been able to plan ahead by just applying, because you don't have to use the accommodations. No one's going to say you must take all time and a half, but no one's going to say if you don't have the time and a half, you can have the time and a half, especially in a college setting. So planning ahead with accommodations is also important. Similarly, with a student who is in high school or middle school, being able to meet ahead of time with teachers can sometimes be helpful, or talking with teachers ahead of time and saying, you don't have to say I have OCD, but you can just kind of meet them, see what they expect, getting class schedules as best you can ahead of time. That can be something that parents can help with too, as best you can, just preparing, again, with as best you can without that sense of dread, but more with just an open mind and saying, this is what could happen. And I'm going to know as much as I can for that there will still be uncertainties no matter what, but preventing the uncertainties from feeling overwhelming as best you can.
I want to thank you, and I want to toss this to both Denise and Marni. It's a question from Anna at 1238. What action do we need to take if our 15-year-old boy does not want to go to school and teachers know about his OCD, but he is struggling to do his homework and has a hard time during the exams?
You want to take it, Marni, and then I'll go after you?
Sure. Yeah. So I think, for me, the actions would be better understanding specifics of what is going on. What are the specifics about school that are so stressful, aversive? What makes it hard to take exams? So I think there's so many reasons, like we've talked about before, that could be contributing. So it would start with really needing to understand all that's occurring. Is it just OCD? Is it bullying? Is it victimization? And that would help guide what we do. So depending on the specific challenges that the child's experiencing, that would guide what we do in terms of recommendations. So are there rituals that are making it incredibly time consuming, or are there obsessions that are making it hard for the child to focus? Is there perfectionism where any task just seems incredibly overwhelming? So, this is where the guidance of a trained therapist who's experienced in CBT with ERP can help build a plan that's gradual, right? Of, what can we do to help set this kid up for success and build more confidence in school, in test taking and homework. And that's how I would approach it. Normalizing, obviously, that some people love doing homework, only probably a few of us, but, I think sometimes we can normalize, we can validate, but we also have to say, hey, this is what it is. And so let's put our heads together and figure out a way to make this more tolerable, to, allow you to be successful with it. Maybe that's breaks, maybe that's rewards, contingencies, whatever it may be. But again, involve the child. And I think this is where that team approach just comes in. You have to work with somebody who can guide you along that way to be successful.
Right. I agree with everything Marni said. It sounds like we need a whole lot more information about what's going on, not just with, why is it hard to do the homework, but, is this anxiety, OCD, or is this also some depression? Is there some ADHD involved? So we'd probably want to make sure that a trained professional was doing sort of a diagnostic assessment. And again, like Marni said, we want to be working with the school. I mean, what's the school home communication like? We'd really want to make sure that was really strong, so that home was sharing information with school and school sharing information with home to help us come up with that more comprehensive assessment. And then like Marni and Ez said earlier, we have a 504 plan, we have an IEP. whatever is driving it will help us determine, is this more appropriate for a 504 plan, or is this special education? Are there learning disabilities here? Are there other more significant emotional health impairments that might qualify this person for, for an IEP? And somewhere in there, if necessary, that you could request testing for your student through the public school system. They have to provide testing. And again, there's a lot more information about this on the Anxiety in the Classroom website. And also, oftentimes insurance doesn't pay for this, but if you're still really struggling to figure out what's going on with your kid, we could also get neuropsych testing. But we start where Marni said, we need more information. So a much more comprehensive assessment of what's happening will then drive us to what the next steps are here.
Yeah, and I think sometimes too, your loved one can seem forceful because they're struggling. And I think a lot of times then if we match them, whether it's a school official, whether it's a parent, if we kind of match that, there's a lot of resistance. Sometimes it's coming in more disarmed and just saying like, hey, you loved school. You used to always go to school. And I'm noticing now you're really struggling. Like, sit down, let's talk about it. It's important to get you there. And I want to hear from you. I think so. That's feedback I get from a lot of my clients is everybody's just shouting at them about school. And it's like, nobody's ever asked them why it's hard, or, they know it's OCD, but nobody's asked like specifics. Ez, I know that the question at 12:42 you wanted to take a stab at from Isostasia about disorganized and planners also give anxiety. So maybe you could go through that a little bit.
Yeah, definitely. I think that, first of all, this is not uncommon. I think people tend to think, oh, because person A has OCD, then they are more organized and on top of things than person B. No. In fact, I find that a lot of times people with OCD tend to have what's called executive dysfunction or trouble with things like time management, organization, planning. It just tends to come with the territory, and sometimes that's not something that's super obvious because OCD tends to be thought of as like the organized diagnosis, or like the person is really good at cleaning up after themselves, which we all know is not OCD. And if it is, it's a lot more than that. With planners, I think the biggest thing is that sometimes people think they have to have a certain type of planner. And I would say that one thing is exploring different options in a kind of as best you can fun way. So, there's digital options and there's also handwritten options. Sometimes I know when I was younger, the handwriting itself was what was giving me anxiety. So I did a lot more digital planners. I actually like handwritten planners now better now that my OCD is a lot more under control with handwriting. And I find that the handwritten aspect actually helps me to plan. There's something about the physical process of writing it down that helps me get my thoughts in order. But then also, studies show that handwritten pieces or handwritten words are more likely to stick with us than typed words. So that's something to think about. But digital is not a bad thing. So looking at different options for planners can be helpful. I'm a firm believer also in the power of a checkbox. So sometimes planners just have those like blank spaces and it can get a little overwhelming. I highly recommend a planner that has lines somewhere and has checkboxes. That soothes the uncertainty that comes with and kind of the overwhelming nature of the blank space. And then, sizes of planners, literally just experimenting with the size of the planner. Sometimes a planner that is too small can be actually more overwhelming, and it's better to have more space, even if it's a little bit clunkier. And the actual time management piece, the last thing I would mention is, I tell this to all my students, and it's something that's helped me immensely, is like not writing down just appointments or when things are due. So not just writing on Thursday, I have to go to the doctor, and on Friday, I have a presentation for work. If you have that presentation for work, breaking it down and write down when you're going to work on that presentation. The breaking down of tasks is a game changer. I think there's something so anxiety provoking for many of us about that one big task written on when it's going to be due or when you have to do it. If you can break it down into smaller steps, it's really, really going to be a lot more manageable. And then if you break it up and you're like, these are still very, very, very stressful, break it up further, like literally like making subtasks for the subtasks. I remember when I had a paper proposal I had to do, in graduate school, and I broke it up into introduction, body, conclusion. I was like, nope, still overwhelmed. So for the body, I was like, all right, I'm going to have to research this piece, then research this piece, literally writing in keywords. I was still overwhelmed. So then breaking it up by, I'm going to spend 15 minutes researching this thing, even breaking it up by time of task and not nature of task. Again, game changers. So as best you can, trying to try these different strategies and even just experimenting. It's okay to not get it right the first time, meaning it's not going to be easy every time, but also remind yourself there's no best planner. I had to remind myself of that sometimes. We always want the just right everything. So the just right planner does not exist, but if you can find something that works as best it can for you in that moment, that's very helpful.
Cool tips from Ez. I love it. I definitely want to bring this question in because I want to make sure that we talk about the IOCDF's anxiety in the classroom. So Matt Bannister, who's a friend to the live streams at 12:43 says, hey all, I have a question about what ways can people or organizations work with schools to advocate for OCD awareness in the classroom for schools to create more future support systems. So obviously, if people aren't familiar, IOCDF has anxiety in the classroom where we're trying to do this just thing. So can, Marni and Denise, can you kind of navigate? So how can people utilize anxiety in the classrooms? How can people take the material, get into their local schools, talk to their school boards, talk to whoever will listen to make, to make a dent and to make a change?
Sure, Marni.
Yeah, I think so. First and foremost, with education and kind of what we're doing, we really have to spread awareness because there's so many issues that anxiety and OCD can cause, but nobody knows that that's what's underlying. So I think, teachers might see something that looks like ADHD, but it could really be OCD, right? So I think we have to do a good job at spreading awareness. Teachers, how you can identify these challenges. Students, how you can identify these challenges in yourself. Parents, right? So whether it's a professional development day where we offer to come in and do a presentation for the school, that's certainly an option. So the Anxiety in the Classroom resource and website has so many great ready to go resources such as PowerPoint presentation, handouts, information for parents if you're a parent or guardian, information if you're a teacher. So the resource really tailors all these different things based on the questions that often come from different populations of who we're targeting. And so anybody can find a group and have some ready to go resources. 504 plans, IEPs, if you look on Anxiety in the Classroom, it gives you guidance on some of the common accommodations, how you can go and advocate for your child in a school. So I think the resources are there. It's constantly growing and building. It can be a struggle to get into schools because schools are honestly busy and overwhelmed with so many different things. So I think the best advice is to, where you can, go to the PTA. PTAs can be a really great advocacy organization. I think personal connections, talking to somebody at a school event, at a fundraiser, those are going to do better than just blanket email. So if you can build up personal relationships and talk about this as an issue and how there are these great resources, and it's really just free, great resources for to in an altruistic manner, just to really help our kids and help our teachers. And I think if you can really talk it up one-on-one, that's going to be the most effective.
Right. Yeah. In addition to all of those things, I think there's so many different IOCDF affiliates across the country. And so if you're a parent and you really want help advocating for getting this information into the local school system, you could contact one of the affiliates and say, can you help me do this? Would someone from the affiliate be able to come and present this? So in addition to the PTAs, which I think those parent organizations are great, there's also special education parent associations that usually give, they have meetings monthly. That's another entry point in. But the IOCD, the advocates, you can even go to IOCDF and be like, I need someone to come talk to my school. This school counselor, there's also school counselor associations. There's like statewide ones and there's national ones. And you could go to your child's counselor and be like, hey, there's an Anxiety in the Classroom online resource. would you be willing to advocate for this content being part of the trainings that you guys receive on an annual basis? So those are some, in addition to what Marni said, a few other practical ways that you might get this information out there as a parent who really wants to help us spread awareness.
Yeah, no, I know. I spoke at a college earlier this year. I spoke at a high school, Menlo High School in NorCal, and there was resources I was able to pull. And I think people don't realize too, it's not just resources, it's like actual things you can pass out, slides, things like that. So, I hear a lot of times like people are like, oh, it's going to be so overwhelming. And I'm like, Anxiety in the Classrooms has all that for you. The only thing it doesn't have is like a human to go. And if you want to be the human to go, or an affiliate member, or an advocate, that's absolutely the best thing you could do. All right, what I want to give everybody, because we're at the 5-minute mark, I want to give everybody like a final minute, 32 minutes. Just what are some final tips for everyone? I think one thing, I'll give mine first, and then I want to give you all more time. But I think two things is, I think one, for what I'm seeing a lot for my juniors and seniors in high school, so much anxiety over which college they go to, and literally like losing sleep, not able to function, crying, tears, no right answer. And I think, because what I always tell people, making decisions when there isn't a right answer, OCD hates that. It wants it to be black or white. So always remember, getting into a college is incredible. I know there's a lot of pressure on high school students to pick the right one, but any college you go to is going to be great. There's going to be an education there. There's going to be connections. There's going to be resources. You're going to meet people. So I think that's one thing. And then second, I just want to highlight what as Marni and Denise said, for the parents. What I see is, when parents start to let their kids not go to school, it starts to get momentum that way. And then that person hasn't gone to school in a year. And the likelihood at that point, it's like fighting a wall, right? So don't let it start, even if they're late, even if you have to talk to a counselor, please, please, please. I'm going to go clockwise for me. So Ez, Marni, and then Denise. So Ez, I'll start with you. What's kind of like a final thought that you want to leave everybody with as we go back to school?
That is a great question. I think my final thought is something that was missing from my OCD treatment for years, and I didn't really realize it was missing, was the self-compassion piece. So as hard as it can be for students and for parents and for educators, we need to be nice to ourselves. And this is a really difficult time, that back to school transition phase. And, it is so easy to tell ourselves that we're being stupid, or why can't I do this like everybody else? Or why am I not making progress the way I want to? But instead of berating ourselves and treating ourselves as less than, it is a game changer to say to ourselves, it's okay. Right now, I'm not where I want to be, and that's okay. Or it's okay to say, I made a mistake and I'm going to do better next time. There's a saying in DBT that they say, I'm doing the best I can and I can do better next time. And I think that dialectic, that important accepting that we're always trying our best. That's just who we are as humans. And next time we are going to do better. We can push ourselves further. That's also very human of us. And when you're saying these nice things to yourself, a gentle tone in your brain as best you can is also really helpful, because it is so much easier to treat ourselves as people who mess up, but also then saying it nicely can be really, really helpful. So it is different to say to yourself, I messed up, than to say, I messed up. And that tone of voice in your brain makes all the difference.
Well said. Thanks, Ez. Marni.
I think it's important that we not only involve our children in the problem solving process, but I think that we instill confidence that they're capable. I think that, that goes really, really far. And so it's important to listen to your children. Don't jump in and solve all their problems. Be a team, brainstorm solutions with them. Encourage them, express confidence. I like the phrase, everything is figure outable. I think we can come up with a plan to figure out most things. But kind of in addition to that, it's important to also set limits, set clear expectations. And I think you can be firm and fair, but not punitive. And we can be supportive, but also have those limits. So those would be some of the things that I would just, encourage some thoughtfulness about.
Well said. And then finally for you, Denise.
Yep, in the last couple seconds. I would just say that everything we talked about today is not going to go as well as it possibly could if the relationship is not strong. So the first point of intervention is always making sure that the relationship between you and your child is a strong one. Or if you're on, you and yourself, like Ez said, is a strong relationship. And that's the foundation that we build everything on. And so make sure that that's what we're being guided by, not just, we need to get this right. We need to get this figured out. We need to get this kid to school. Like, the relationship is key.
That's extremely important. If the conversations are always about OCD, they check it out. Remember, they're your kid first, and that's what's most important. Well, I just want to say to everybody that's joined us today, that's watched, that's interacted with us in the comments, from Ez, Marni, Denise, myself, we absolutely thank you for always hanging out with us here at the live streams. Remember, you can always count on a live stream on Tuesday evenings at 7 p.m. Eastern or Wednesdays, 12 noon Eastern. We also sometimes have surprise live streams, so make sure to go over to iocdf.org/live. As you can see on the screen, go to anxietyintheclassroom.org. It's your one-stop shop for all resources for you, for your family, and for schools. Lastly, don't forget that you can always watch this live stream back and any others at youtube.com/IOCDF, and you can share that with friends and family. And make sure to go to iocdf.org and support the organization. Remember, we are a nonprofit. It's always nice if you can donate or support us in any way that you can. Thank you so much to everybody that was on the panel with me. Y'all are amazing, incredible. Have a beautiful rest of your Wednesday. Thanks, and we'll see you back soon.